Okay, let's begin. Good afternoon, honorable judges and fellow delegates. Today, I am Putri Utami Lestari from Indonesia, representing my team to present our research poster entitled "Do Digital Health Interventions Effectively Improve the Management Outcomes for Asthma Patients? A Systematic Review and Meta-Analysis." About 300 million people globally suffer from asthma, and an additional 100 millions are potentially out at risk. Asthma is commonly described as a long-term inflammatory illness that affects the airways. The fundamental goal of asthma management is to cultivate and sustain effective asthma control, which includes reducing the severity of the symptoms, preventing exacerbation, and reducing the risk of asthma-related mortality. Clinical outcomes may be improved by incorporating technological and digital interventions into clinical care pathway, which could give patient a prompt individualized support. Therefore, this study aims to assess the efficacy of digital health interventions in improving management of outcomes for asthma patients. Moving on to the method, the included studies were found using the literature searching method in multiple databases such as PubMed, EBSCOhost, and Scopus until June 2024. This research was conducted to PRISMA guideline, and all of the included studies were assessed for bias using the Cochrane ROB 2.0 tools, and the meta-analysis was performed using Review Manager 5.4.1. And the result, there are 15 randomized control trial studies eligible to be assessed in this analysis. And the analysis included 2,086 individuals in the intervention and control groups and were done in 10 countries. Moving on to the forest plot. On the children populations, the forest plot shows that the FEV1 is significantly better in the intervention group. Among both children and adults, the results shows that the intervention group has a significant overall effects on improving the FEV1 outcome. However, on the adult populations, the result shows that FEV1 is not significantly improved in the intervention group. Moving on to the ACT score outcome. On the children population, specifically the 4 until 11 years old category, the forest plot shows that the CACT score is significantly better in the intervention group. And among both adults and children, the result shows that the intervention has a significant overall effects on improving the ACT score outcome. However, on the children not less than 12 years old and adult populations, the result shows that ACT score is not significantly improved in the intervention group. So, from this study, it can be concluded that currently digital health intervention has significant and beneficial effects in improving the outcome of asthma management. Further research studies with the most updated related topics data should be done to give the most updated evidence in asthma management. So that's our team presentation. Thank you for your time and attention.
Now you have 3 minutes for a questions and answer section.
Thank you for your presentation. It is quite interesting. Could you give me some hints for the further study in this area, please?
Okay, thank you, Janice, for the question. From our team recommends to maybe renew the methods and try another type of digital interventions. Because so far that the type of digital intervention has been done like web-based system, mobile health app, sensor-based electronic monitoring, SMS reminders, and electronic asthma action plans. Maybe there are a renewal of the categories of digital intervention. So yeah, maybe our team suggests do that some research.
Any more questions?
Hello. May I ask about the interventions themselves? What do you suggest for those interventions? I mean, there are a lot of intervention. Which one is more readily be able to implement in practice the most, in your opinion?
Okay, thank you, judges, for your questions. Currently, maybe a majority of people have smartphone, and our team suggests like maybe the better, or the best like digital health intervention so far are mobile health or M health app. Maybe that's my answer.
Thank you. Very interesting.
Okay, thank you so much.